Hello, this is Dr. Mokhtar Yerima. Welcome back once again to my channel. Today I'm going to talk about generalized anxiety disorder. There are several types of anxiety disorders. One of them is generalized anxiety disorder. In subsequent videos, I'm going to talk about the other types of anxiety disorders, but let's get right into generalized anxiety disorder in this video. So, as the name suggests, generalized anxiety disorder is a type of mental condition in which the predominant symptom that the person has is anxiety. Anxiety is a situation in which the person worries a lot about a lot of things. He is anxious about so many things, so worried, restless, kind of concerned about virtually everything in their life, virtually everything under the sun. They are worried and anxious about their work. They are worried and anxious about their health. They are worried and anxious about their relationships. They are worried and anxious about their family. They are virtually worried about all sorts of things. So the predominant thing that you have in generalized anxiety disorder is the worry and anxiety, kind of apprehension, kind of restlessness. Now it is called generalized anxiety disorder because the anxiety is also called free floating, which means there is no any specific situation or condition or circumstance that brings about the anxiety symptoms. And if anything, the anxiety symptoms are everywhere. They are associated with everything in the person's life. Just like I mentioned, it is the health, is it the work, is it the school, is it everything? So, and that's why it is called generalized, and that's why it is also called free floating, which means there is no any situation that brings it about. Unlike in other types of anxiety disorders, in which the anxiety or the worry is centered around something, maybe is it fear of social interactions, as we are going to see in social anxiety disorder or social phobia. So, what are the symptoms of generalized anxiety disorder? So, like I said, the key symptom of generalized anxiety disorder is a persistent, excessive anxiety or apprehension or worry about something. And when you worry about something, it simply means that you are expecting a terrible outcome to emerge from any aspect of your life. So if you worry, for instance, about your relationship, it's because something in your mind is telling you maybe the relationship is not going to pan out well. So in essence, the worry in anxiety disorder, especially generalized anxiety disorder that we are now talking about, is because of the fact that the person has a feeling of foreboding, which means they tend to expect a catastrophic outcome to happen with virtually every aspect of their life. Now, this worry or this anxiety tends to become uncontrollable in the sense that the person does not seem to have the capability to control it. The person may not be able to have the capacity to turn it off. Usually, the person is at times even worried about the fact that they worry. So that means even worry about worry is something that is expected or that occurs in people who have generalized anxiety disorder. Also, the worry seems to happen without any cause. Normally, you might argue that virtually everybody from time to time worries about something, right? And that is correct. But in people with generalized anxiety disorder, they worry about things that are not even there, even when there is no reason. And even if there is a reason, the worry that they have or the anxiety or the apprehension that they have is out of proportion for the cause for the concern. Also, the anxiety is usually very persistent. So it is not something that just comes for a few minutes or a few hours and it goes. Rather, it is something that persists for weeks and even for months. And it pervades in virtually every aspect of their life. Virtually everything under the sun that is in their life is involved in this worry or in this anxiety. So is it their health? Is it their finances? Is it their relationships? Is it their families? So everything in their life, this worry tends to pervade into it. So that's why it is pervasive and it is even considered intrusive because it keeps kind of intruding into their life. So it is persistent, which means it lasts for several weeks or months. In fact, for it to be diagnosed, according to the American Psychiatric Association, the diagnosis cannot be made until this anxiety and anxiety-related symptoms of generalized anxiety disorder have persisted for more than 6 months. According to the International Classification of Diseases, days, it has just got to be there for months. So that is the core symptom of generalized anxiety disorder. Another symptom of generalized anxiety disorder is restlessness, which means the inability of the individual to relax, to maybe sit still, or to generally relax in their mind, to relax in their bodies. The inability to relax in their mind is evidenced by the persistent worrying thoughts that keep coming into their minds, and the worrying thoughts are not centered around one particular thing, but they can affect virtually anything that goes on in their life, like we stated. The restlessness may also be manifest in their bodies, in which sometimes they may not be able to sit still and they keep maybe pacing up and down and what have you. Another symptom of generalized anxiety disorder is irritability. Irritability, as we've mentioned in some of our previous videos, is the tendency for the person to be edgy, the tendency for the person to be made angry following minor frustrations. So something that is not supposed to be significant ordinarily tends to make them to get easily angry. Another symptom of generalized anxiety disorder is what we call poor concentration. Poor concentration simply means the inability of the individual to focus their attention for a significant enough period of time in order to achieve something. So they might not be able to focus their attention if it is to make a decision. So they might find that they are indecisive, or they might not be able to focus their attention to be able to carry out a certain task, maybe read a book, maybe watch a movie, or maybe even follow through a conversation. So that inability to focus attention for a sustained period of time is what is also lacking in people who have generalized anxiety disorder. Another symptom of generalized anxiety disorder is what we call motor tension or muscle tension. The muscles of the body in people who have generalized anxiety disorder tend to be tense, as if in a situation to kind of respond to something. In anxiety disorders, and especially in this generalized anxiety disorder, the body of the individual tend to perceive a threat in the absence of a threat. So if you perceive that there's going to be a threat, or if you think that there's going to be an imminent threat, the tendency is for your body to put you in a state of fight or flight, right? And since your body has put you in a state of fight or flight, then the tendency is for your body or for your muscles to be in a state of readiness. Now, that state of readiness is what manifests in that muscle tension, in which all the muscles of the body are tense. Now, this muscle tension can result in what we call tremors if it is severe, in which the bodies or the hands of the person with this disorder tends to tremble or to kind of shake like this, or in some situations it might not necessarily result in tremors, but it might result in aches all over the body, especially aches in the neck, aches in the or pain in the head or neck and other parts of the body. This can be explained by the fact that the muscles are tense, and it is supposedly because the body is trying to put itself in a position in which it should fight or it should flee from something. Next symptom of generalized anxiety disorder is sleep problems. People who have generalized anxiety disorder tend to have a lot of sleep problems, particularly difficulty falling asleep. You go to bed and you are tired and you expect to initiate sleep, but sleep will simply not come. So this is classical in people who have this generalized anxiety disorder. But other forms of sleep problems might occur, such as difficulty maintaining the sleep, or even waking up repeatedly in the middle of the night. But classically, difficulty falling asleep is more predominant. Now, this sleep problem that is found in patients with generalized anxiety disorder tend to be accompanied by nightmares. So these nightmares, in which the person might have bad or terrible dreams when they sleep, is in keeping with the general theme of the generalized anxiety disorder, in which the person is already feeling threatened despite the absence of a threat, but nonetheless the mind of these people with this disorder tend to perceive a threat. And so if you perceive a threat, the tendency is for you to be having bad dreams. So those bad dreams are in keeping with the threat that your mind is already perceiving. So these are some of the symptoms that you find in patients with generalized anxiety disorder. But there are other symptoms. Those other symptoms, we call them symptoms of physiological arousal. because you're anxious, you are worried, your body is in a state of fight or flight because you somehow are perceiving that the worst is going to happen. And so your body is already in a state in which you are aroused somehow. So that physiological arousal is going to manifest also with some signs and symptoms in your body, and that include a number of them. One of them is a feeling of what we call palpitations. Palpitations is your awareness of the beating of your heart. The heart usually pumps or beats continuously, non-stop, from the time you are born to the time that we die. Now, but this beating of the heart is something that happens and it is silent and we are not usually aware of it. The moment we start getting aware of the beating of our heart, that is called palpitation, and it means that something is probably amiss. So that awareness of the beating of the heart is called palpitation, and it is one of those things that can be found in people who have generalized anxiety disorder. Another feature of physiological arousal in generalized anxiety disorder is sweatiness, the tendency for the individual to be sweating a lot, including in the palms of their hands and in the face and other places, is also found in people who have generalized anxiety disorder. Another symptom that might be present in generalized anxiety disorder is changes in the pattern of breathing. The breathing of the individual starts becoming rapid but shallow, what we call hyperventilation, in which they are breathing fast, but the breathing is not deep enough, so the breathing does not achieve its purpose. Usually when you breathe, you want to bring in oxygen and you want to bring out carbon dioxide. Now, in this kind of hyperventilation, or in this rapid but shallow breathing, you are unable to get enough oxygen, so that gives them a sensation of breathlessness somehow. So this symptom of breathlessness is one other symptom that might be found in generalized anxiety disorder, and sometimes it is even confused for a maybe respiratory problem or for a cardiovascular problem. Now, because of the way the individual breathes, the person begins to have some complications of that, and that also gives them additional symptoms, including dizziness and lightheadedness. That also might sometimes be accompanied by tingling sensations in their hands or in their feet or in some other parts of their body. So by and large, these are some of the symptoms that you find in generalized anxiety disorder. But for the symptoms to be considered significant enough to warrant the diagnosis of the disorder in the hospital, the symptoms have to have lasted many months, and the American Psychiatric Association suggests that the symptoms have to last for up to 6 months. Additionally, the symptoms have to result in clinically significant distress. When we say clinically significant distress, it means that the condition is so disturbing to the individual, it is already causing him a lot of discomfort, and sometimes the discomfort is not just affecting him, that distress might also affect their loved ones. Imagine you worrying about your health, and imagine finding yourself in a situation where you worry about the worry itself. You worry about anything, you're always anxious, you're restless. That seems like a very distressing condition. And so if it results in this much distress, then it might be considered enough to be diagnosed as a generalized anxiety disorder. Also, the condition in some people result in what we call disability or impairments. Because of these concerns and these symptoms, the people who have this condition might not be able to function effectively at work, or even to take care of themselves, or to relate with their family or the rest of the social settings that they are usually part of. So that disability, if present, might also signify that this condition is significant enough to warrant being diagnosed and treated. So also, for generalized anxiety disorder to be diagnosed, other conditions that might bring about symptoms similar to those of generalized anxiety disorder have to be ruled out. And those are medical conditions sometimes, and sometimes these are other psychiatric conditions. So the important medical conditions that can result in some of the features of generalized anxiety disorder include a disease of the thyroid. There's an organ of the body called thyroid gland. Sometimes if the thyroid is overproducing one hormone called thyroid hormone, that might result in some of the symptoms that are similar to those of generalized anxiety disorder, and that condition should be looked out for whenever an individual presents with features of generalized anxiety disorder. So, how can generalized anxiety disorder be treated? It is a condition that can be treated pretty well. There are effective medications, and then there are other interventions that can be given other than medications. The medications are several in classes, and they are called anti-anxiety treatments. Also, there are some self-help things that have been found to help in people who have a generalized anxiety disorder, including physical exercise. Now, some people asked some questions when I made video on depression, where I mentioned that physical activity is important in improving depressive symptoms. And the question was whether this same physical activity might be helpful in improving anxiety symptoms. And the answer is yes. There is evidence to suggest that people who engage in regular physical activity tend to have some alleviation in their anxiety symptoms. So physical activity is something I would recommend for people who have generalized anxiety disorder, in addition to taking medications and or going through therapy such as the cognitive behavioral therapy. So by and large, this is generalized anxiety disorder, and thank you for listening.